First thing for those on the phone, just mute yourself. We have to keep telling you that. You have questions, put them in the Q&A portions. Yes, you'll all get slides. You'll get a recording of the sessions, and we'll have that available to you as well. As we go to the agenda, which is the next slide, it's pretty packed, but I think it's going to be really interesting, and we're really thankful to have the folks that are here to help talk about the topics. Sandrine Pirard is the West Regional CMO for Carelon. She is a psychiatrist, a wealth of experience, bunch of initials after your name. You're going to introduce yourself, so that's good, because I won't do a good job with that. We'll break and do some panels, and Michael Garrett's going to help us think through how do we bridge some of the gaps that we will have just heard about, but other gaps that we have within Washington. We'll take a quick break. We'll bring it back. We'll talk about things important from a purchaser standpoint, the EAP environment, and how we sort of navigate that system, and then we'll close it up by the end of by noon, if you will, and go from there. We'll also periodically during this we'll give you a little test to see if you're still listening. So we'll have little polls and things like that. The next slide, just a reminder, we continue to do a bunch of different seminars through the Alliance. So we've got a hypertension one next week. We'll do some other ones in the fall. We'll take a little bit of a break during the summer. We've got a bunch of work groups that continue to work throughout the year with a big focus on the impact of value on our purchasers. So what does value mean to a purchaser? If you're a provider, you don't normally think that way. Providers think about quality, and that's very important, but they don't necessarily think about who's paying for that quality and what value is for them. And we're going to hopefully move that along. We'll do another release of our community checkup toward the end of the third quarter. Now we're going to rerun that waste calculator that we did before, looking at overuse, misuse, and underuse of care, and how does that get impacted by where you live. We'll also have the ability for you to toggle between, your percentage that's quality versus your percentage that's cost, and which one's most important to you when you want to stratify either a county to live in or a provider group or otherwise. We're finishing up our back pain collaborative, and we've ongoing work within our quality improvement committees on access to well child care, which is somewhat poor based on our data within the state, and chlamydia screening, which is tough for a lot of folks because there's an inherent bias in terms of taking a full sexual history to make sure you're screening people appropriately. And then, of course, if you're interested in joining the Alliance, I got to put a plug in for us. Then there's information here, and we'd love to have more engagement, more opportunities to work with everybody. And so with that, I also want to thank the folks sponsoring this event. So Behavioral Health Systems, United Healthcare, thank you, and Carelon for helping us get together. Hopefully we'll get bigger groups together as people feel increasingly more comfortable in doing so. And with that, I'm going to move to the first poll question. So this is the homework for you. And I think online you'll have there's like a QR code or something that you'll be able to see, or there'll be a way to do it. Some way to take the poll online. In the room here, I think I'm not sure how you take the same thing. Same thing on your phone. And do we have a way to show them what that is? Oh, there it is. Oh, I don't have it on my slide, so there you go. So the question is, did you or someone in your family access mental health or behavioral health services in the past 12 months? And that can be a broad or as narrow as you want to define that. It could be EAP, it could be therapy, it could be mindfulness training, whatever, however you want to define that. We'll see how well people are doing with our technology. That's why we're doing it up front. We've got a couple more of these, later in the day. Rolling in, good. Okay. It's not a tough question. It's like a yes or no. It's not, you don't have to say how many times you went. And we didn't ask the real tough one. What barriers were there that stopped you from going, or did you want to? So we're trying to make it easy to start with. 11 yes and 1 no of the first 12. That's pretty impressive. And so that's great that people are accessing care. So that's, pretty fantastic. I would have guessed it would be a much lower number. And with that, I would like to bring Dr. Pirard up to talk to us and do the keynote. And I'm going to let Sandrine introduce herself because I won't do a good job. And it's really about some of the stats in Washington and what we're seeing within our communities. I think it'll help set the stage for what we want to talk about as the day goes on. So thank you.
Thank you. First, I have to figure out how this works, but it's supposed to just click the button, right? Oh, okay. Okay, great. So yeah, we can go to the next slide. So good morning, everyone. Very excited to be here for this important discussion. Sandrine Pirard, I'm the West Region Chief Medical Officer at Carelon Behavioral Health. West, of course, include the great state of Washington. And I have here with me my colleague, Dr. Shimoni Krishnan, who is fully dedicated to the state of Washington. I've been working for Carelon since 2017, so almost 6 years. I'm a psychiatrist, also addiction medicine specialist. And the bunch of letters after my name, I think, reflect the fact that mental health is extremely complex and really kind of to try to find solution. We have to think through, as a clinician, as a researcher, kind of on a population health basis. So I guess that's kind of explained the letters. Next slide, please. I need to. Okay. So Carelon Behavioral Health, who are we? I think, many of you may know us as Beacon. We changed our name back in March. So we are the largest behavioral health management organization with over 35 years of behavioral health experience, 25 devoted to crisis system of care models, managing more than 44 million lives, have 250 clients, and include a lot of employers, and of course the state of Washington as well. So, we really have been in these states for many years. Really have enjoyed working with, everyone. And part of the work that we do here is to maintain the crisis system. So today we're going to be reviewing some national and Washington state trends, talk about the concept of mental health, distress, and illness, review some data about the impact of mental health in the workplace, talk about wellness and resilience, as well as reviewing some of the impact of COVID on our emotional journey. So before getting there, and sorry, I need to get back in here. So we know that meditation and mindfulness are extremely important to maintain mental health. It's something that's extremely easy to do. So what I would like to do to start with is to take about 30 seconds and ask you all to relax. First, you put your feet on the floor, rest your hands on your laps. Inhale slowly over 4 seconds. 1, 2, 3, 4. Hold that breath for a few seconds and mentally say, relax. And exhale slowly. Inhale again slowly. Hold that breath and mentally say the word calm. And exhale slowly. Inhale slowly. Hold that breath and mentally say the word peaceful. And exhale. Notice that you feel more relaxed than you did a minute ago. Some trends. So we truly and unfortunately are facing a mental health crisis. Prior to the pandemic, about 1 in 5 or so Americans were struggling with a mental illness, being depression, anxiety, bipolar, other. Unfortunately, with the pandemic, we are approaching 1 out of 4. There's a higher prevalence among female. Likely among male, it's being underreported because we know that, there are a lot of stigma for everyone, but maybe even higher for men. The highest prevalence is among young adults, so really kind of those who are entering the workforce, and the highest among adult reporting 2 or more races. Youth. Nearly 14% of youth aged 12 to 17 reported one major depressive episode between 20 and 2021. So that's major depressive episode. So certainly, many more have expressed, some distress, have struggled with mental illness. Suicide is the second leading cause of deaths in youth aged 10 to 24 and the leading cause in 14 to 15-year-old. The national suicide rate, 13 for 100,000, Washington 15.8, which means that on average 2.6 youths between the age of 10 and 24 kill themselves every week in Washington. And we know that for every youth who dies by suicide, approximately 10 others will survive an attempt. Lack of treatment. Nationally, 28.1% report, that they have their needs met. In Washington, 16.8. As of 2015, 21 counties in Washington had 0 psychiatrists. And, one of the big issues, it's not just in Washington, it's everywhere, that the really kind of the workforce is approaching a retirement age, and we don't have a lot of, kind of new individual kind of entering the pipeline. So, really it's kind of across the board, and unfortunately, again, with the pandemic, there is a rising need, but many of the mental health professional and other healthcare professionals really, are burned out and have been leaving the workplace. So what is mental health? It's a set of emotional, psychological, and social well-being. It affects how we think, we feel, we act, and it determines too how we handle stress, relate to others, and make choices. Treatment of mental health, has pretty much always taken a backseat to physical health. There have been a lot of things in recent years, including the better understanding of impact of mental health condition, the opioid crisis, methamphetamine crisis. It's hard not to know someone who hasn't been impacted. COVID, definitively. We're talking about the kind of second epidemic, which is mental health epidemic. The younger generation is more open to talk about mental health, and really kind of recognizing that addressing emotional well-being improves productivity at work. So distress of illness, right? And so that I think is key, because everyone, I think no one in this room can deny that at some point, they've been anxious, they've been sad, they felt like they were depressed, not wanting to get out of bed. I mean, most of us had, have a drink of alcohol once in a while, but those are, time limited, mild to moderate response to an event, not necessarily an illness. Really kind of when we come to mental health disorder, it's when those symptoms become severe, for a longer period of time and affect the person functioning. In terms of substance use disorder are diagnosed when someone uses more frequently in higher quantity than most people, and that it again affects a person functioning. So quickly, I guess we should have done a poll. What is, when do we reach a state where really kind of, consumption of alcohol is impacting a body? And I put that because I think it's a question that not a lot of people actually can answer. Now, that doesn't mean if you drink more than that you have an alcohol use disorder, but really means that it starts to impact your body negatively. So for men, no more than 4 drinks on any day. For women, 3. For men, no more than 14 drinks in a week, and for women, 7. And one note for pregnant women, it's 0, and certainly for older individual, it's also kind of much lower alcohol content. I put that out there because, we know, unfortunately, that alcohol use has increased during the pandemic. We know that, substance use has increased. And even though it may not reach the point of substance use disorder, it can definitively affect, every, kind of part of our body, including, kind of our brain and mental health. So the stress response, again, it's adaptive during a brief emergency, but if it's continue, kind of over days, leading to anxiety, depressive, physical symptom, then this definitively we are talking about disease. And here, it's kind of a representation that pretty much, there is no part of the body that cannot be affected. And as we know, we may have a stomachache, a migraine or other, and in fact, may be related to anxiety or other. So mental health in the workplace, how does the stress look like? Sleep problem. If you have someone who's not sleeping well, lower quality of work, being late, dozing off in meeting, lack of concentration, maybe missing deadlines, more accident on the job, slow of thought, excessive worry, again, kind of trouble making indecision, aches and pains, going to the doctor, increased healthcare cost, forgetfulness, poor quality of work, self-medication, increased use of alcohol, substance, missed deadline, not coming, increased emotional responses, poor relationship with coworker, maybe being short, and then this presentism where it's basically being there but not being there. So what do we know? We know that good health is good business, and good health includes mental health. We know that mental health impacts productivity, engagement, and your bottom line. So how does that impact? Well, again, there's a very strong connection between mental and emotional well-being and productivity. I want to say again, distress doesn't mean illness, but it can still negatively affect performance, and if left unaddressed, that can basically get worse and worse and worse. Now, we also know that if there is excessive demands on an employee, that also can result in stress and then contribute to difficulty managing emotion, difficulty, focusing, making decisions. So this is crucial, right? Because, and I think we all talk about the fact it's important to take care of our mental health. Who is doing it in this room? No one. So, why it's important is that, when there is this so that, oh, well, I need this person more, or, this person, need to stay, overtime or, work on weekend. Think about the fact that it may look like you will kind of have an increase in effect in productivity because there are more hours. You will have actually a decrease in productivity. So it's much better, I always say, to have someone, 20 hours, let's say 40 hours, of course, being kind of, let's say at 80%, kind of productive versus having someone 60 hours being 20% productive, right? And again, reducing distress really, really will impact, increased satisfaction. It will help with recruitment, retention, will reduce absenteeism, it will increase work and engagement, productivity, and certainly, again, financial performance. So depression, largest driver of employee loss of work days as compared to any disorder. Mental illness, short-term disability claims are increasing, and also discrimination charges against employer, for all those disorders that are extremely impactful, but you cannot see, right? Anxiety, bipolar, PTSD, depression. So it's really kind of increasingly, there and impacting your business. In fact, 12 days versus 2.5 days of unplanned absences are related to mental distress. And it's in billion that, we can estimate loss of productivity. So what can you do? Addressing the stigma, and we'll talk more about that. Making mental health and physical health, kind of equal in the workplace. So it could be having, a day focused on your mental health. It could be, kind of talking about it the same way that, you may talk about the importance, for example, the way you may carry a load, the other. Get to know your employer's needs. Share affordable access option. Build a culture of well-being, including mental health and stress management. Considering having an EAP on site, and certainly provide access to, from kind of like the online, stress management tool all the way to a strong EAP. And we'll talk more about that during the panel. So stigma, we know it's definitively impacting access to treatment. And why don't people speak up when they see other? So you may see, one of you colleagues struggling with anxiety because you kind of have this fear of inviting privacy. You feel like maybe it's not really businesslike, not allowed, and basically we don't know what to do. And why don't people seek care? They don't want to admit they're unwell. They're afraid that it will, kind of maybe impact their work status. They're embarrassed. They feel alone. So what is wellness? So what's very important is that when we talk about wellness, it's not just emotional. It's not just physical. It's financial, social, spiritual, intellectual, environmental, occupational. And why it's very important, I think, is that, more and more EAP program, don't just focus on, physical, emotional, right? But really talking about the entire person, right? We talk about all health. Well, that include all of those pieces, right? And wellness is not the absence of disease. That's the other thing, right? I mean, you kind of reach a state of wellness, well-being when you're thriving in all of those area. No, only 7% of all will thrive in all these areas. So most people basically will do well in one or two. So it's hard to achieve this state where everything is going well in your life. But again, it's important that you think about all of those pieces when to want to reach a state of wellness. Resilience, what is it? It's the ability to basically withstand and rebound from a crisis. It's really kind of this elasticity that you can see, with some material, but also that's in all of us. And I think it's very important to remember that. Because sometimes, being, and we should be really focused on kind of mental illness and, the mental health crisis, but it's very important to recognize that all of us, it's kind of a basic characteristic of human being, have that resilience in us. And how can we really kind of build on that? So what are some of the core components? Connection. You may have seen that kind of the Surgeon General, and a lot of other, have basically raised the fact that loneliness is a major factor in mental illness. So connection. And in a state where a lot of us are working from home, it's difficult, right, to achieve that. Physical and emotional wellness, healthy thinking. What is it? It's really kind of being able to, kind of let go of, those kind of negative thoughts we have. Not that we cannot have any of those, because that's what it is, but trying to let go of them and kind of more focus on the positive. And then having a purpose. And that's very important. Whatever you do, right? From being at the front desk to, being like the CEO, having a meaning. And I think that's very, very important for employer. We all have, vision, a mission, but are we really mission driven? And kind of being able to open, kind of big meeting, small meeting with, let's focus on the mission, right? Let's remind all of us why we are in here. That really can help with well-being. And then if again, there's a need, please, really kind of offer way for your employee to seek help, making something that is not something we need to stigmatize. It's important. Encourage your colleagues, your employee, if you see that they're struggling, to seek help. So few of the things that we can do, structure, important, again, in a world where we're living from home, I mean, what's the structure? When do we start? When do we end? Take control of whatever we can control. It may feel like everything is out of control, but there may be one thing that you can control. Reach out, nurture social connection, sense of belonging, and also find a way to be accountable. So that's another piece, is that sometimes, we're in a state where we're feeling like we're losing control, but we also feeling like, well, is that important? But actually finding a way to be accountable also helps in feeling like you're on power. Look after basic needs. So we all, and I'm sure, folks who are virtually, we are going from one meeting to the other, to the other, to the other, and we don't even take time basically to look after basic needs, like, bathroom breaks, for example. Take care of our physical health, kind of getting up out of that chair, kind of walking around, very important, thinking positive. So finance, extremely important, in fact, because we know that if not, then it's kind of, there. And we know also that the pandemic has, really impacted, unfortunately, finances for a lot of people. And then avoid engaging in negative coping strategy. What is that? Well, kind of drinking, taking drugs. You may be prescribed something, let's say, for anxiety, for pain, kind of taking, extra doses, anything like that. Working from home, for those of us who are working from home, even if you are in kind of a small apartment, you may be working in the kitchen or, wherever, it's important to be able to kind of set some structure. So this is basically the place where I work, sense of structure in terms of time. I start whatever time, I end whatever time, but, really kind of being able to set those boundaries, so that it's not kind of, oh, my computer is pretty much where I eat, where I cook, where I sleep, and I take it everywhere in the home, and I basically check my email every time, I turn around, or, being flexible, because, oftentimes when you're home, there are other demands, so being able to be flexible, but also staying focused, right? So you cannot just constantly be interrupted by, things that are happening in your home. Taking breaks, winding down, that's the other thing at the end of the day, just kind of, again, take a break. Don't directly go and cook dinner, but maybe go out, for a walk or something. Don't forget to interact with human being, not just on the screen. Maybe have, and luckily now we can, be back in person. So maybe you have like weekly meeting with your staff, monthly, depending where you situated, and ask for help when needed. So this, it's actually a kind of various phases that we can go through when there is a disaster. It's something that had been recognized way before COVID, right? But has been also used to kind of think about how COVID has impacted us on an emotional journey. So you may remember 3 years, something like that ago, right? We started to kind of hear about COVID, but maybe didn't really think about, that it would come and hit us. So it's a warning, maybe a little bit anxious, and then it really kind of like hit us. It's here, right? It's here. It's in our state. So then, we really kind of start to see that, we start to feel low, we start to feel, anxious. And then the entire community, kind of hospitals and, everyone really kind of start to think like, what can we do? And there's almost this kind of heroic phase, right? It's like we're all in it, we're going to fight it. The community come together, but then we thought it was a month or 2 or 3, and a year after it's still there. We see kind of an improvement with vaccine, we're hopeful, but then it's still there, right? So that's really kind of when you really kind of hit this emotional low. You feel like it's forever, you can get out of it. And then kind of slowly there is this kind of, rebuilding, working to, the grief, really kind of, there have been a lot of losses during COVID, and kind of, saying, well, it's the new thing, right? I mean, it's the new way of being. I mean, I think all of us will be a little bit more, kind of pay a little bit more attention, right? If we have a cough, sneeze, if we're going, maybe I'm not going to the office on that day. But really kind of, as, some people say, it's the new normal, right? Being able to, to rebuild. And, again, I want to emphasize that many people surviving a disaster, and, COVID, can be thought as a disaster, have this kind of increased sense of community. We're all in it together, deeper recognition of meaning, purpose, and actually better ability to cope with future life stressor. So that's important. And, we all done, at some time, this has been an incredibly difficult time. And we also have gained things from it, right? So we have learned, kind of looking back, what did we learn about ourselves? What worked, what didn't work? So that's very important, I think, to stress out as well. So as we are winding down, I would like to do another exercise. Make sure you're sitting comfortably. Leave your arms and legs uncrossed, feet on the floor, hands on your lap. Close your eyes. Think of a place that's safe, calm. Could be a real place you have been to, or an imaginary one. Could be a place that brings back fond memories. Preferably it's somewhere outdoors, natural setting, a beach, a park, a forest, a mountain. You may be sitting around a campfire, watching the waves roll in, having a picnic, seeing a stream fall over some rocks. Ideally, you're alone. Always just few loved ones. Crowds can be fun, but they are also stressful. Have you got your calm place? Now pay attention to what your senses are telling you about that place. What do you see? Could be water, could be trees, animals, birds. What do you hear? Leaves rustling, surf, firewood popping and cracking. What do you feel? The wind blowing across your face, body against the sand. What do you smell? Flowers, food cooking, wood smoke, forest floor. Take a moment in that calm place to soak in all these sensations at the same time. Take a few slow breaths, and when you're ready, open your eyes. Thank you. Now I will bring it to a panel.
Thank you. Before Dr. Meyerhoff presents, we're going to do a little poll. My name is Michael Garrett. I'm an independent consultant in health equity and behavioral health and case management programs. And I think this is great that the Alliance is doing it now. I just was reflecting, last month was Mental Health Month. This is Pride Month. And next month is Minority Mental Health Month. So perfect timing. And I think I'm the only panelist from the one last year as well. So I guess the Alliance can't get rid of me. So I think we're going to do I think it's slide 39 for a Slido polling, if we can pull that up. Great. So if you can scan that either virtually or here. The question is, which of the following are you doing to improve access to mental and behavioral health services? So as you pull it up, which of the following are you doing to improve access to mental and behavioral health services? Hopefully everyone's pulling that up and answering. Oh, can we show the question? There we go. I was also going to just add to that, to Dr. Pirard's presentation, that I think also, as we look at wellness and mental health, one of the issues as well is for historically marginalized populations, they have additional stressors in their life that may impact their mental health, right? And so it may be confusing sometimes about why people are reacting in different ways because they all have their own life experience. There's their race, ethnicity, sexual orientation, disability status, and so forth could also impact. And I'll be asking the panelists some of those questions about what can we do to help address the cultural competence needs of all individuals. Okay, so we have virtual therapy, which I'm going to ask about as well. I think it's a great option. Incorporate self-care absent to benefits, ensure diverse providers in network. That is touching on the concept of patient-provider concordance, either racial concordance, gender concordance, which can lead to better outcomes, almost always in better patient experience. So glad to see that. Care navigation for specialty services, child, adolescent, psychiatrists, and therapists. Great. There's no other categories? Is that it? Okay. Yeah. 2 more categories? None of the above? And the other one is other. Thank you. That's great. And when we do the panel, we're going to also talk about what can plan sponsors do, providers do, and plans do. And I appreciated the fact of the conversation around the impact on disability as well, because we can look at health plans, but also disability carriers and other related benefit programs. Okay, Dr. Meyerhoff, you're going to introduce yourself.
I appreciate it. Thank you. All right. Well, welcome and thank you for having me here. I appreciate the opportunity to talk to you today. I'm Senior National Medical Director at Optum Behavioral Health Solutions, part of United Healthcare. I oversee all of our clinical guidelines, clinical policies, but I'm also heavily involved in medical behavioral integration, youth and adolescent services, a patient safety initiative. So lots of efforts to really improve the wellness of our membership. And today I really want to just talk about some of the exact things that you just saw in that questionnaire about how can we increase access to the services that people need. And what we know is that the pandemic changed a lot in mental health care. And it's even evident in this room today, right? Now we have a majority of people virtually attending this meeting instead of in person. And I think the issue is that there's certainly some benefit to that, but there's also a loss, right? We're losing human interaction, human touch, creativity that happens when you're together and more spontaneous. So this is some of the changes that affect the mental health world post-pandemic. It's a good thing that we've been able to go to virtual care, and we'll talk about that in a second. We actually offered virtual care way before the pandemic and only had a 2% uptake. And of course, during the pandemic, the majority of people went to virtual, and now we're in a hybrid model, which we'll talk about in a second. The bad thing is there's really been a tsunami of problems post-pandemic, right? As Dr. Sandrine said, prior to the pandemic, about 10% of the population reported anxiety and depression. Now it's close to 40%, right? Substance use has skyrocketed, stress has skyrocketed, and a lot of the lower level symptoms that people just ignored are now really coming to light post-pandemic. Young people lost a lot of important developmental moments to build resiliency, and they're struggling as well. So we're going to talk about some of these things quickly, and then we'll get to the panel and really kind of get into it more deeply. But we've been using technology to expand access to care. So we've gone, I'm sorry, let's go to that slide. I forgot about that slide, sorry. Real quickly, if we go back one, it's affecting everybody. Everybody knows somebody who's been affected by increased mental health issues. The majority of the population thinks there needs to be better access to care. And as I said, 4 in 10 adults are reporting anxiety and depression. Okay, next slide. So I'm trying to get caught up here. So as I talked about, we had very low uptake on virtual care, and now it's really a hybrid model. And it's really actually been very beneficial because what we're finding is that people are getting care where they want it. We're meeting people where they are, And in many ways, care is more convenient if they can access it either virtually or maybe even some kind of hybrid of in-person and virtually combined. And what that is resulting in is greater access, quicker times to treatment, and really, surprisingly, greater adherence to care. We are finding that people are going to their appointments more often, more regularly, when they have a virtual option available to them. Let's go to the next slide. The other thing we just talked about is how the low severity issues have risen up as a result of the pandemic, right? So we use a lot of data and analytics to analyze our population and figure out what kind of care that they need. And if you look at this slide back here, what you see is on the right hand of the slide are traditional care, outpatient, right? Pharmacy, medication management, and facility-based care, partial hospitalization, inpatient care, residential. Right, those are the traditional levels we've always offered. What's happening is we're really trying to address the needs of a larger population that's coming to our attention, but we don't have more providers or facilities to really care for that population. So how can we address the needs of those lower level issues without creating more therapists overnight, right? And so we are building capabilities along the continuum that are evidence-based to really address these more lower level issues that are post-pandemic. Let's go to the next slide and really talk about some of those. So we're going to talk about the left side, which I describe as enhanced support. It's not treatment per se, but there's a lot of people out there who don't necessarily need formal mental health treatment. They need support, they need guidance, they need gaps in care closed, and they need coping strategies. And so what we really focus on is, let's start with education, right? Teach someone about stress, teach someone about coping, teach someone about resiliency. Then let's move to the virtual wellness opportunities, mindfulness that we just kind of went through in our last talk. Wellness focus, applications that can actually apply cognitive behavioral therapy techniques through technology. And then telephonic emotional support. Can we call someone in crisis and just deal with that crisis in that moment without the need to go to formal treatment, make an appointment, wait 2 weeks, whatever it may be? And this is really where the EAP, the benefit of the EAP comes in. And I know you guys are going to have a whole conversation about that this afternoon, but this is a critical piece in that enhanced support tool. And then finally, something that we are finding really beneficial is adding coaching. Coaching is not therapy. Coaching is support. But again, it's done by people who have certification in coaching for mental health, and they follow structured cognitive behavioral therapy techniques to really help people navigate difficult times, difficult moments, and even assess them for whether they do need formal treatment and get those referrals made in a seamless manner. And it's surprising how many people can use coaching and really get their needs met as they kind of as they deal with the stress of the post-pandemic world. Next slide. So these are some of the opportunities, right? We can use applications, self-care, wellness, mindfulness, web-based tools, ICBT, and then again, coaching, which can be, one-on-one, weekly kind of support, dealing with, barriers to care, dealing with stressful events, and can really make a difference in terms of one's outcome. And the studies show that if someone with a serious mental illness has both formal treatment and coaching, they actually have better results in the long term, more time in the community than someone who only has just formal treatment. So it's a really positive addition to what we can offer people more immediately in this new world. Next slide. Finally, we also kind of want to not forget about young people. We're going to talk about that right now. Young people really came out of the pandemic maybe worse than anybody, right? They lost important developmental milestones, they lost resiliency, and obviously there's a lot of stress, anxiety in the world. We've developed what we call a family support program, which is really meant to help parents, guardians, caregivers, and young people navigate the healthcare system, which we know is incredibly complex. So we kind of have a case manager that kind of takes on a family and really helps them through all the issues that they need to navigate, whether it be higher levels of care, medical equipment, medications that need to be pre-authorized, whatever it may be. They've got a one-touch person that can help them navigate this complex world. And what that allows is for parents and caregivers to actually focus on their kid rather than on navigating the healthcare system. We also partner with a lot of virtual groups. And the nice thing is many of these are really focused on younger people now. Talkspace, they just lowered their age down to 13. And Talkspace really does kind of virtual treatment as well as asynchronous treatment. Charlie Health is a virtual intensive outpatient program. We never would have thought that somebody could attend day treatment virtually, and yet not only is it being offered to adults, it's being offered to young people, and it's having great success, much more consistent attendance, and actually greater wellness and improvement as a result of these virtual programs. Equip is a virtual eating disorder program, helping people really address their eating disorders issues, which we know are complex and difficult, and yet now we have an opportunity to really help people where they want to receive it. And then finally, Bend Health is a program that really focuses on youth coaching. They actually can take kids as early as 1 year old and work with the parents. Many of those kids are having sleep issues or behavioral issues. They have, child and adolescent psychiatrists available, and they have coaches and really can address the needs of these families early on, but to get ahead of the curve in terms of the issues that affect young people with behavioral health concerns. So if we go to the next slide, one of the things we all know, right, is that the current system is failing young people, right? We have not built it to accommodate the way they seek treatment. So we actually started at ground zero and interviewed teens, young adults, caregivers, parents, and tried to find out what are the needs of the younger generation in terms of mental health and substance use issues. What we learned, if you go to the next slide, is that young people lurch from crisis to crisis, and they don't really think in that moment, oh, I should call a therapist, I should call a psychiatrist and go get treatment, right? What they do, they experience a crisis, and they go home, and they get on social media, and they look for validation. They look to see if they're okay. And the problem is we don't know whether they're getting good information or bad information. We don't really come into play until the middle of this squiggly chart here, where the formal mental health program kind of exists and people get into formal treatment and get the help that they need. Our task, our need is to really get ahead of this. And so we're kind of starting to rebuild how we think about youth and adolescent mental health and substance use by really focusing on, first, let's start getting a greater presence in social media, right? Let's start bringing validated, proven tools to young people who are looking for help in that moment. They may have been bullied, they may have had a breakup, they may have lost a friend, and they're looking for answers. We need to bring tools that are validated to this population at the beginning. So we're kind of moving towards working with influencers who address those issues, who could bring these kind of individual tools about bullying, about breakups, about school, about stress to these young people way, way, way before they ever formally seek treatment. Same thing with the hope that we're going to kind of focus on, let's go to the next slide, on school programs, right? School is the first place some of these issues are identified. And so we need, and Optum is working to move forward in providing more support in school-based health systems to provide greater mental health services to young people in that setting. Again, getting ahead of the curve before they're actually looking for formal treatment. And so these are some of our already offerings. We do a lot of work with ABA. We have experts who really make sure kids are getting the highest quality care. But we're really moving towards, youth navigation, single session, meaning just one subject kind of informational program that kids can look at to really learn about a particular issue that is affecting them personally, school-based, and then collaborating with pediatricians who we know are doing the majority of this work, and how can we really bring them more expertise in terms of mental health and substance use care. So these are some of the efforts to close the gaps. None of it's perfect, but it's a journey, and I'm looking forward to your questions and your insights as we head to the panel. Thank you.
So I think now we're going to move over here and have a panel discussion. Cool. Yeah. Maybe I'll leave this here. Is this on? No. Is it on now? No.
Can you hear me? Yeah.
Hello? Hello? Oh.
Hello.
So thanks for your great presentations. And I'm just thinking that, the Alliance represents different parties involved in healthcare. Plan sponsors are usually employers, providers, and health systems. And so I'm going to ask you some questions about each one of those parties and what they can do. And let's start with, what can each one of those parties do to increase access to care? So again, think employers or plan sponsors, providers, and healthcare systems. That'd be great.
So access to care, as we have seen, is probably one of the major barrier to really kind of make sure that we address all of those symptoms for use for adults. I think one of the things that we heard is really kind of being able to augment the workforce. As you said, we want kind of have psychiatrists just coming overnight, or therapists. So really kind of focusing more and more on what can any of us with no training. They actually are training, like mental health first aid. It's a little bit like kind of CPR training. A lot of training that you can find online. For example, kind of, I don't know if you will get it on a bit, one of the things that I had referenced is the American Psychiatric Association as a fantastic toolkit, for employer. You can also kind of, there are some sheet that you can print from there. It's free access to everyone. As part of EAP, I think most of us do offer training too. So, if you have some EAP services, you can kind of access some of those training. So that's really kind of what all of us can do, right? As far as peer coach, those definitively are more and more important, and we're relying more and more on those individuals who can really kind of support. I think one of the fantastic thing is that they basically walk the walk. Right. So, whether you have, a mom or dad struggling with a youth who has, autism, you can basically be matched with a peer, kind of a family member who has been through, the same struggles. Right. So, or you could have, someone struggling with a substance use disorder and really kind of being matched with someone who has been struggling with substance use disorder. So I think that's something in the field where it's not just having a peer, but really kind of having a peer who has basically been through and understand really kind of what you have gone through. A pediatrician, primary care, that's really kind of the other very, very important part of the workforce. How do we support them? Through education, certainly, more and more there's what we call the care collaborative model that actually, started here in the great state of Washington. Really kind of how do we, provide support, kind of consult, maybe mild to moderate, cases could just be a phone call, with, the counselor, the psychiatrist, or if someone is kind of more severe, then having, that, person, that APR and that psychiatrist kind of, meet with that person, kind of assess, provide treatment. So that's crucial. Another piece that is offered pretty much I think across in most states, some that actually we are supporting, it's Consult 9. So it's this basically free number that any primary care, any pediatrician can call and have a free consult for the patient that they're seeing and where they have struggled. And then certainly supporting the workforce, trying to get young people interested in getting in the mental health field. Certainly the pandemic has on one hand we have lost a lot of workforce, but I think on the other hand they really kind of increase awareness and interest into that workforce. And I could go on and on and on, so I will pass it on.
I just want to make a comment. Those are great ideas. And actually in the PowerPoint, which you're going to get, I actually have a number of those resources. And I've worked with employers that have done various ways to educate frontline managers on mental health issues, mental health first aid, and I've actually done trainings as well. And my experience with that was that managers who are not clinicians are really anxious to learn, like, what do we do? And what do we say? And part of it is being aware of potential symptoms, but also what are the benefits that are offered, to their employees so that they can provide some guidance. But anyway, thank you for those great insights, Dr. Meyerhoff.
Sure, I'll try to. Is this working? Hello? Okay, good, thank you. I'll try to be brief, but it's a very big question. First and foremost, let's start with employers, right? I think a really fundamental piece of mental health that gets overlooked is that the better you take care of someone's mental health, the better their medical issues are going to be. And if you're looking at cost, solely at cost, by investing in mental health, you're actually investing in reducing cost on the medical side. So I think that needs to be a fundamental belief, both from the employer and the payer side of the equation. Employers certainly can invest more resources into mental health, but one of the interesting pieces is in a big organization, when you bring these wellness programs to people, there's a bit of mistrust about it, and it's kind of perceived as you're checking the box. What really needs to happen is you need to find a trusted source who can bring their mental health story to their frontline staff, and that has a huge impact on people being willing to seek mental health care compared to a just generic program rolled out by the administration and really has no bearing on an individual's life, and they don't even trust why that program is being brought out. So use trusted resources to promote wellness. At the payer level, we need to really begin the process of understanding what are the savings on the medical side and stop trying to find the savings on the mental health side, because that's a losing equation. And simultaneously to the workforce, we probably need to look to be paying even more to really make it more attractive for young people and newer students to choose to go into mental health. From a provider and facility standpoint, they need to understand no matter what we do, mental health is going to be a costly endeavor. It's not going to be a money maker like a surgery. And yet we need our healthcare systems to step up and do the right thing in the community by providing greater mental health services.
So I would augment by saying, I think we need to look at medical costs, pharmacy costs, and disability costs. And you mentioned that in your presentation to get the whole picture about what happens when you don't provide mental health services. The other thing where I used to work, I would love to give the actuaries a bad time and say, if mental health costs are under maybe 5% of the total cost, it's popping up in other places. I can tell you that right now. Because around 20, maybe 25% of people in a given population have some kind of mental health issue in a given year. And so if you're spending 2% or 3% on mental health, it's coming up, whether it's disability or absenteeism or what have you. And so it's a different way of thinking about costs because we want to increase that mental health expenditure, which makes the actuaries really nervous, which I love doing that. And so it's another way of looking at your total spend. And then, as you pointed out on the disability, like what percent of claims are related to mental health, and what can we do differently to address that?
And to add to that, by adding these lower level, support services, not everyone needs formal mental health treatment. So in fact, there may be cost savings by expanding the offerings that we can give our members, because we meet them where they are and the type of care or the type of support that they need.
Yep, that's great. So next question, again, is from all the different parties, employers, providers, facilities. What can we do to increase clinical quality? And I'll just start off by saying, in mental health and substance use disorder, we just have such a paucity of reliable, valid quality metrics. Readmission after hospitalization, which is rare, in terms of your point, Dr. Meyerhoff, like a lot of people don't need hospitalization. We just don't have a lot of good metrics. And so yet. And so some thoughts about that, about what we can do to increase clinical quality.
Yeah, so I think unfortunately the mental health system is way like 20, 30, I don't know, years behind the physical health. One of the reasons is because it's very hard. Like, how do you measure it? And you're mentioning readmission. A lot of the current metrics that we have is basically more like a process, right? So it's like measuring, how long someone is in the hospital, how many times readmitted. Even, I don't know if you may have heard about the EDIS, metrics, which is kind of like used nationwide, validated metric that kind of looks at various aspects. When you look at the physical health, it's really more about the true outcome. Where you look at the mental health is, well, when, for example, you have been to the emergency room for a mental health issue, did you follow up? Well, I mean, that doesn't tell me anything about quality, right? So really, really kind of that is something, and all of us, right, whether it's provider, payers, employers, I really think that it's important to, hear from all of you, right? How do we actually measure quality? What does it mean to have quality treatment? And, again, kind of going back to that sense of wellness, it's not just about, my anxiety symptoms, are resolved, right? It's, how do I feel? How do I function? Right? And all of those domains are very important. If you ask me one metric, if we just had to measure one thing, quality of life, right? Because we have so many things that we need to measure. But I would say quality of life, that really will cover, I think, most of the thing. Again, I would implore, I really would encourage all of you to kind of think and provide input, because we are at a time when everyone is looking to build for, those metrics.
I agree. I do think there are some process measures that I would like to see amplified, like the time it takes from requesting an appointment, receiving care, because it does impact, I think, the trajectory of the clinical situation. Outcome measures, of course, are the holy grail, but I think we have some additional process measures we can look at. And then even a process measure like screening for depression, anxiety, substance use disorder, and then reporting on it so employers get a sense of the mental health status of their population. But I love the quality of life. Thanks.
I'm just going to add a little bit and not repeat what was said, because I agree with everything you guys said. But I think a piece that's missing is the role of professional societies and accreditation agencies. We actually chose to adopt our clinical criteria from professional societies, the American Academy of Community Psychiatry, the American Academy of Child and Adolescent Psychiatry, American Psychological Association. Those are our criteria. We believe that if we're using criteria that is developed by the providers, it's going to be a much more positive interaction with us when we're doing utilization conversations about appropriate care. I think the place that's lacking is these organizations are beginning to create criteria, which is really wonderful, but then are they actually working with their membership to really educate them about what is quality care, what is appropriate care, and how can we get professional societies and accreditation agencies for facilities to really get on board with focusing on the quality piece, rather than being a kind of, we're going to check the boxes and you need to meet certain requirements. And I think that's where we could really make some headway, because to leave it to the payers and the insurers, it just becomes a conflictual conversation if we're trying to talk about appropriateness or quality and we have disagreements in that regard.
And if I may add something, so, when you contract with one of us, have kind of EAP services, I would really, really encourage you to think about what quality means for you, for your workforce. I would actually, have, kind of, maybe have a group of employee really think about what does it mean so that you can basically look at what you're being provided and what you're paying for. Is that really kind of what we want? And provide the feedback, right? Provide feedback about, okay, well, this is great. First of all, we love the app. We love the, the coach or, other than we being offered. And this is kind of what our employee are looking for. And maybe could we have this in addition to that? Or this is working, but that really doesn't work.
Yeah, and I would say really, and I've done this before, is working with your employee resource groups or business resource groups, because I do believe, you were saying, Dr. Meyerhoff, find out, basically how the patients or clients are receiving care and making sure that you're hearing the voices of everyone represented in the entire population, so that you don't get a view from one subpopulation versus another. And so one of the things that I discovered in working with different employee resource groups around this topic, in working with Black, Indigenous people of color, the primary ask was that they have the ability to find someone who looks like them or who shares their same identity. That was the primary thing that was a concern of theirs. Consistently over several employers that I work with. So I think that's a really important point, getting the voice of the customer, if you would, about how they are receiving services.
Well, and to that, I think a common theme in mental health that has always been successful is using providers and added supports that have a lived experience similar to the individual who is going through the issue at the time. There's a greater level of trust and a deeper level of understanding of what that individual is experiencing. And so it's not surprising that that would be the request.
Yeah. Next question, and you addressed this quite a bit in your presentation, but I'll see if you have any other ideas about what, again, all the parties can do to address stigma around mental health. And just to acknowledge that I think stigma is impacted by the work culture, by their own family culture that they come from, the geographic area, and so forth. So it's a complex issue, right? So any additional thoughts you have about addressing stigma from all the different perspectives?
From kind of going back to from the employer is, talking about it. You may also have individual, anywhere on the spectrum, in terms of staff management who have been struggling and may actually be, open to talk about it. I think it really kind of helps bring it back home. Also, make an employee feel like, well, so-and-so is successful, right? I mean, so-and-so is, leading this team or that team, but, they have been struggling and that's okay, right? Because their needs have been met. So talking about it, providing training, you may have, some kind of flyer on the wall, very important. From a provider point of view, from a primary care, pediatrician, also being able to ask question, be, kind of like that being part of, all the question. I think, for example, talking about suicide, a lot of providers say, oh my God, but if I ask about it, I mean, I'm not sure what I'm going to, to kind of do if they say yes, or, I mean, it's kind of a little bit intrusive, the same way, for example, when you talk about, sexual activity out there, but really kind of making that part of, this is health, right? So we need to address that. As part of the payers, I think we have a big role also in, kind of providing education to our members, making sure that it's not kind of mental health is kind of on the side, right? I mean, it's this little thing that you can click on the website, but, it's to me, it's all about talking about it, educating, basically, letting folks who have been struggling with mental illness have a voice.
Great.
Yeah, no, bringing mental health into the light, talking about it, and really focusing on it coming from a trusted resource in that individual's life is the way in which to start to bring these conversations into the open and make people realize they're not alone in this journey.
Yeah, I think another way you alluded to it is take things like Mental Health Month or Minority Mental Health Month or Suicide Awareness Month, Depression Awareness Month, and incorporate that into your benefit communications. Then again, and this is mainly to employers. And then what are the resources available? So they can find the 1-800 number for EAP or to get into the behavioral health provider network or what have you. So it's an ongoing, refreshed opportunity to communicate that, and you might catch someone's attention at the right time. Mm-hmm.
I think one more piece I really want to add on stigma is the addition of virtual care has really helped with being able to address the needs of individuals who do have stigma or work in a work environment where stigma is really present. I think of, police officers, prison guards, people who would never be seen walking into a mental health office in their community who can now access care virtually. And so I think that in itself, and it has been a huge improvement in terms of addressing the repercussions of stigma.
And actually healthcare professionals too, right?
Absolutely.
Nurses, physicians, social workers that are, they don't want to go down the hall to the psychiatric clinic, label as well. So we have a question?
We do. We have a question from the audience.
Great.
How can we address safety in Seattle when we are requiring in-office of our staffs? And in particular, regarding violence and drug use, it makes staff feel unsafe in Seattle and negatively impacts their mental health.
So I will assume, right, that the question is really about kind of what's going on in the city, maybe also in the workplace. It's, I think, kind of going back to making it as yes, that is impacting, right? I mean, so basically kind of giving a voice to the employee, kind of going through, what impact it can have on their well-being, and then providing them with tools. So, for example, one of the resources actually that we have, EAP program with a lot of training, but one is, what do you do if there is active shooter that has a tremendous, right, impact? So what can we do, right? I mean, of course, there is the healthcare professional and all that, but also as employer, what can we do? So, it is definitively rising everywhere, unfortunately, but really kind of providing with the tool. I think walking people through what does it mean, a little bit like the COVID, right, a disaster when it hits. I can say that at least, for what I've heard is that a lot of, folks who have been kind of, looking through that say, wow, that's really actually what I've been through, and kind of being able to put word, kind of on what are the feelings, and then, what can we do, to protect.
That's a tough one. I'll just jump in real quick and just say that, I really empathize with the question. I think that it goes way beyond just what's happening in a downtown core. When I grew up, we had fire drills at school. Now we have fire drills, hurricane drills, earthquake drills, and active shooter drills. And it's just created a level of anxiety in people that is just much higher. And I can understand someone who comes to a downtown core where things have kind of not come back together, and they can feel very unsafe and nervous. The reality is, and I know there is more crime, but the reality is that people suffering from mental health issues generally, and I mean it really in a large scale, are not violent people. They can be off-putting and they can be scary, but generally are not in any way violent. And in fact, I think in many ways our system is really failing that population, because the longer people stay in that state of mind, the harder it is to treat. But I think there's something important to be said about recognizing that solely because there's someone on the street who's maybe talking to themselves or even yelling, that it's very unlikely they're violent.
A couple of thoughts. One is I know that some employers have implemented a buddy system so that, and I know this sounds tough, but that they strongly encourage employees to always be with someone when they leave the building to address concerns around safety. I also think that there's this emerging area of psychological safety that, in terms of risk, we've thought about biological risk and chemical risk. And I think we need to start thinking about psychological risk. And I think you can get that feedback from your employees by having that, we've talked about several times, that employee dialogue. Another thing that an action that employers can take is the Seattle Police Department, if we're talking about Seattle for a second, has something called the Crisis Intervention Committee, which I've actually been serving on. And it's a great forum to express your concerns as an employer and what can the Seattle Police Department do. Frankly, just having the dialogue with the Seattle Police Department about what can they do to help support your employees to increase their sense of safety. I found that pretty receptive, actually, situation.
Yeah, I imagine they'd even be willing to come and
Yeah.
speak to your population.
Yeah, exactly.
I just want to open up to the people sitting in here. Anyone have a question for the panel? Yes.
Yeah, I wanted to ask about when we talk about what employers can do, I want to talk about some more primary prevention things. I've had the work of Laura Panett at the University of Massachusetts that employers can do what they can to, or should be doing what they can to maximize autonomy for employers. I mean, create work situations and get away from the gigification of the workplace. Like, we're going to call you on 1 hour's notice to come in for an extra shift. And I mean, that's not such an issue at upper income, but that's certainly an issue of lower income jobs. Another one would be real efforts to match skills with job requirements, not to over or underdo it. So don't have people doing things that they are much more capable than, but also don't have them do things that they don't have the skills for. And then the third one I think you've talked about quite a bit, which is social support, sort of peer support and trying to create a sense of community. But these are more primary prevention things, whereas we've really been focusing on, how to self-help and then also how to get people more formal care. So I just wondered what your thoughts about those are.
I mean, I would say they all are important. Going back to the importance of reminding everyone, all of us, that there's resilience, because I think that's what's important, right? It's that, I mean, it's of course, once it reaches a certain level, we want folks, individual to have access to care and all that. And I think, you really illustrated is we want to act before that, right? So all of those are, I mean, in my eyes, extremely important. Really empowering and as you're saying, kind of making sure that the demand is not excessive, because if the demand is, there will be distress, and at the end of the day, it will impact your bottom line, right? I mean, that's what it is.
And I think, as Dr. Sandrine Pirard said before, I don't know if I got your last name pronounced right, but okay, said before, control, as much as is possible, is really an important factor in employees' wellness. And so let's say there's this requirement now to go back to the office. Is there any flexibility in that? Is there any point in that where the employee has some control over a day at home or a half a day here or there? I mean, any kind of control that an employer can give that employee, including maybe what type of job they're actually doing to match their skills, actually gets them more engaged, makes them feel more a part of the organization, and actually helps their anxiety, because anxiety directly comes from lack of control. So the more you can give them a sense of control, even little pieces, the more invested they're going to be.
The other piece that I want to add is that, we always say how those millennium, right? But the importance, talking about really kind of being able to understand, and match, is that every generation is different. So, really learning instead of saying like, this new workforce, right? Really, basically learning, why is it? What do they need? And be able to adapt to that, because no matter what, we're getting older and the new generation is coming, right? So that's something I would add to.
That's great. I also think what you're maybe referencing too is this phenomenon of burnout. And the World Health Organization actually defines it as a occupational phenomenon. That's the word they use. And so I think, and again, they're in the handout you're going to be getting, there are some resources there about what can employers do to prevent burnout and then what to do when someone is experiencing burnout. And again, particularly healthcare professionals and other first responders have been really impacted by burnout. And so I love the idea about looking at the tools and resources for people to be successful in their job is a great one. I also want to leap to the other end of the spectrum, which we've not talked about, which was how to help an individual or an individual's experienced mental health issue with their family in returning to work. And I'm an old rehabilitation counselor by background, and I think we get very focused on musculoskeletal, you know, I'm sorry, we get very focused on the physical and changing the desk, and that's all great. But I think I've seen a real lack of what employers can do to help if you yourself have had a psychiatric admission, or if you had an adult child who's, you know, been in a residential treatment facility for 3 months. You know, what do you say? What do you do? What kind of you were alluding to, Dr. Meyerhoff, too, like what can we do to accommodate the needs? Is it I need to be in our office by myself, I can't be out on the cubicle floor, or whatever it is. And the Job Accommodation Network is a great free resource that has all sorts of accommodations by condition, including but not limited to mental health and substance use disorder. So I think good point about prevention. We've talked a lot about coaching and then treatment, but then also the return to work aspect I think is really important because people need to, you know, work and be able to pay their expenses and so forth.
Just want to add that, yes, job accommodation in the mental health field is really critical and way overlooked.
Yes.
And it really does lead to greater presenteeism, greater productivity, and really can make a difference in the workplace.
I would add to that, you know, we all know it's very hard to hire, whatever the field you're in. And I think that really can help, right? If you can really show that you are promoting, you're supporting, you know, mental health, you are supporting, you know, individual who may be struggling with mental illness, that will really help you, you know, in terms of hiring, retention.
Yeah. Yeah.
Paul Burens. I'm a family physician. I had a question about workforce. During the pandemic, we've lost about 100,000 nurses and about 100,000 physicians. And I wondered if any of you have data on mental health workers' workforce losses.
Yeah, I mean, we lost a tremendous amount as well. And the, you know, issue is that the needs is going up, right? We have less and less. So how do you kind of address that gap? So I think unfortunately it's across the board, and, you know, kind of going back to how can we leverage, you know, individual may not be licensed, but, you know, can be trained, can, you know, have certification. And then, you know, other two is this whole, you know, idea of collaborative care model. What can we do so that really kind of we can, as they say, use everyone at the top of their license, right? So it's, you know, it's for thinking. Or, you know, another one I think that we're not always, you know, using, but really, you know, should start thinking about is group therapy or group medication. Actually, there are, you know, some model where, you know, everyone with a similar condition, you know, may come to a group and you have a prescriber there, and, you know, the prescription will happen, you know, plus some support and other during group. So it's really a way to multiply, in a sense, you know, the time that we have with healthcare provider.
Yeah, I don't have those stats either. I'm sure we could get them, but I will say that the addition and the kind of popularity of virtual care has brought some of those providers back into the workforce, which has been very helpful. But it certainly has been, I think, an overall reduction at the wrong time.
And I think a corollary statistic would be what % of mental health clinicians have left provider networks. So they may still be practicing, but not accepting. So that's another important factor as well. There is the emergence in this state, I don't think it's been passed yet, of a behavioral health support specialist, which is a bachelor's prepared, more along the lines of coaching and so forth, scripted CBT and so forth. So I think that's a promising trend to help, at least partly, with the workforce. And I think I'm getting the hook here by Denise.
Thank this panel so very much. This has been really fabulous. So thank you to Michael, Dr. Pirard, and Dr. Meyerhoff.
Thank you.
We'd like to hear a couple of messages from our sponsors. So we'll play those, and you're welcome to. And then we'll come back we'll take a break, and we'll come back at 10 minutes to 11. But we're queuing up our messages right now.
Today, more than ever, employers understand the importance of investing in their employees' mental health. At BHS, we offer employers seamlessly integrated solutions for addressing their employees' behavioral health needs through a 100,000 member preferred provider organization, creating a healthier workplace for all. BHS's customized behavioral health programs include personalized high-touch services for all mental health, substance abuse, and EAP needs. BHS Work-Life Solutions include our standalone employee assistance program, robust education and training services, and our customizable Wellness First program. Our advantages include access to a designated care coordinator, which provides a singular point of contact for all member and HR needs. BHS's Safety First division is a standalone drug testing solution for employers nationwide. Through Safety First, employers have access to critical drug testing and screening services. Types of employee testing include pre-employment, random, post-accident, reasonable suspicion, and return-to-work drug screening. Safety First's team includes a comprehensive team to support employers with medical review services, administration, billing, and issue resolution. We work with companies of all sizes, including Fortune 50s, small and large municipalities, all size manufacturers, and PEOs, to name a few. We are here to support your workforce and your employees. Behavioral health, it's all we do.
Empathy is at the core of everything we do, because meaningful connections and compassionate care enable people to achieve both mental and physical well-being.
Today,
Thank you. Welcome back, everyone. My name is Nancy Board, and I'm going to be kicking off this part of the morning focusing on employee assistance programs. And I'm assuming that everybody that's listening in has to be familiar with employee assistance programs because they've been around for 50 years. But I will focus on some of what's working in EAPs today, what I think is not working, and we're going to have a bit more of a discussion later about that as well. So let's talk about what's realistic in today's environment, because the reality is a lot of things have changed over time. And yet, from where I sit, sometimes there's frustration because too much hasn't changed. And we've touched on that a little bit, but I think before the end of today, I hope that we have a bit of a more robust conversation about this and really get at the heart of taking some actions that are significant, that are compelling, that are realistic and doable, and that we can all participate in. So I'm not going to go over everything that describes what I'm about, but just talking with Denise a minute ago, and I think a part of my career that's helpful maybe for people to know is that I've been fortunate to be able to have not only a local and national career in EAP, but I've done a ton of international work. In fact, I just got back from a European forum on employee assistance held in Luxembourg with folks represented from 30 countries, including a psychologist from Russia who was still there and participated online with us, and also a representative from Kyiv in Ukraine. So more on that perhaps later if anybody's interested in hearing. And also I've worked the Asia Pacific region and had a long career developing networks throughout Asia. So not just EAP, but behavioral health providers, practitioners, physicians, and other kinds of ancillary services that support mental health and well-being. For those of you that are familiar with crisis work that a lot of EAPs do, I've been involved in servicing and working with the United States Postal Service with homicides, suicides, and other kinds of workplace violence incidences. And unfortunately, that has informed my career around crisis support and the benefits that we offer employers in this area. Another piece of work that I've done, for those of you that are familiar, is help to implement the Smart Health Program, which is the Washington State's employees and their family members' wellness program and their initiative. And then finally, the work that I do now at the Washington State EAP is really focused on how do we impact those that are less serviced in our communities, those in the more marginalized groups within our state, folks that are impacted, that are deeply hurting. And so since the killing of George Floyd and other initiatives we've implemented, we've also looked at our diversity of our network and have increased providers that can see people that look like them and are part of those groups. So what works? Let's talk about that. The fact that employers do have a commitment to mental health and well-being is significant, and that they actually, at least in my experience, I find that most employers really do care about their employees. It's not just a tick-the-box exercise, but they do care, and that they want to be in a position of bridging the gap. And that's what we do as EAPs often, is bridge the gap between an employee accessing some sort of support for mental health or emotional health to getting support through their insurance network. So we act as a gatekeeper, if you will. Being able to look at personal issues that impact employees as well as issues that impact them at work is a big part of the focus, as I hope all of you know, about employee assistance programs in general. And that's how EAPs actually started, was addressing alcohol issues at work. And then that, of course, expanded into where we are today. Being able to have access around the clock is important and significant, that an employee in distress can contact any EAP anywhere with access 24/7. And that's really true in most of the countries around the world that offer EAP services. They actually are accessible 24/7. And of course, now with online programs, it's really just the way it is. Understanding addiction, understanding mental health, understanding treatment, understanding insurance carriers, and how the systems of care work across Washington State is important for any EAP that's offering and providing services to employees. And as I mentioned a minute ago, the one element that I think puts EAP programs in a position that's very different than other kinds of mental health services is that very quick access and intervention to crisis response, to emergency services when it's psychological in nature. So whether that's a natural disaster, a murder, a homicide, a death, any area where employees are disrupted because of some emotional distress, EAPs should be in a position to provide some immediate support and relief so that employees can get back to the job of doing what they're there to do. So let's talk about what doesn't work. Over my 30-year career in EAP, I've had many, many moments of feeling good about this profession and being able to be in a position to provide support and care and help and guidance and a listening ear to most of the people that I work with. I've also experienced some frustration, and I think some of you as employers or purchasers may have seen this as well, around a lack of flexibility and innovation. It's so necessary that we are able to pivot and move on the dime. And we've all seen, all of us have done this in the past 3 years. We've had to get creative. We've had to think about how we deliver services, and it's super important to continue to be innovative and creative in the way that we work. This lack of local or regional response can be an issue for crises and for situations that occur on a national or international level that impact our workforce. It's so important that we're able to address this with employees, to be honest, to be upfront, and to even think about who might be impacted at work, whether that's an earthquake in Turkey, and we have Turkish staff, whether that's the war in Ukraine, and we have Ukrainian staff, or families that are displaced in other ways, whether that's racial violence that's happening in America. We have to consider who's in our workforce and who's impacted and be able to provide support. So for organizations or EAPs who are not stepping up in that way, it's a huge missed opportunity. We talked about it this morning, and I'm glad you mentioned it, about providers and diversity, in the sense that I think too often we are not thinking about marginalized folks within our organizations. We are just operating status quo. But we've heard also that people want to be seen and heard by people that look and live the way they do. And so it's critical that there are diverse providers, diverse skills, ages, genders, racial identities that is represented within the EAP that you have an arrangement with. Because our provider network is filled with clinicians, people that were trained in mental health, behavioral health, and tend to have a very focused practice around diagnostics that are used through insurance companies, sometimes there's too much specialization and not enough generalization. And so for us, it's really important that our folks understand and can holistically assess what's going on with someone, not just from a mental perspective, but it could be that the primary issue that's driving someone to receive care is because they're one paycheck away from bankruptcy, or because they've just been diagnosed with breast cancer and they can't talk about it at work, or because their child just died by suicide and they have nowhere to go to talk about that. It's important that we as mental health EAP professionals dig deeper in our own assessments and understand and become more generalists so that we know what resources are available and how to provide that support quickly. An ongoing issue in our profession has been around lack of standards and data, quality, and commitment to excellence. That's changing. We do have good data now, much more than we had in the past. And I think for all of us in this room, I think you all know that generally for every $1 an employer puts toward an EAP, they get $4 back. So there's data available, and it's important that that be shared. Too often it's driven simply by costs. Most employers in the United States have an EAP. If you're an employer group over 50 employees, chances are you have one. How good it is, how utilized it is, what's your relationship with that particular partner like, those are other questions for you to consider. And also the piece that's so critical is that too often there's a lack of understanding about what the real business need is and the support for business and employee well-being. So what's realistic? I believe today that any EAP should be driven with a strong commitment to DE&I and also to belonging. I think it's critical. I think we have to continue to innovate and change and look at our populations and make sure that we're not just ticking a box for any service. The good EAPs are doing that, and there are many of them, but that's so critical that we look and reach out to marginalized populations and groups. I've already mentioned it, but a diverse network is so critical. People with lived experiences you spoke about as well. That all of us have a commitment to breaking down barriers to access. After all this time, after 50 years of EAPs being available in our national landscape and workforce, there are still barriers to access. And it's something that all of us need to give some serious thought to. Every EAP is different. Every organization is different. Every leader of a EAP organization is different. And so often the values and the quality and the ethics behind delivery of services starts at the top. So some are more committed to support than others. We also must challenge the status quo. I think you as purchasers should expect and demand innovation, expect and demand flexibility, expect and demand that your partners in EAP are always looking at what's most relevant, state of the art in terms of technology and services, ethical behavior, and clinical competency. And as I always say, never compromise on quality or ethical practice. And I'll pass it on to you. Thank you.
Thank you, Nancy. Let's see if I can figure out some technology here, okay? Oop, going the wrong way up here. There we go. My name is Sarai Childs. I am the Executive Director for Business Health Trust. So I'm going to talk, a lot of what Nancy said, I feel like I just want to repeat because there's so much good stuff there, right? And I want to talk about the journey that we went through as an organization to select our EAP, and why we made a change, where we came, what wasn't working, what is working, and fully transparently, we are still in a new development stage of a new EAP, and why that's important. So first of all, what is Business Health Trust? What do I bring to the table here? So I represent about 1,000 employers. Business Health Trust is an association health plan. So we offer health insurance, and our value proposition, our core value, is to offer great insurance, is to offer affordability. And I always say affordability in healthcare, right? But it's actually to be a resource to employers. We represent 1,000 employers, and we want to do things differently. We want it to be approachable. We want to support our employers who they can then support their employees. And the EAP and the mental health piece is really an important part there. Over the last few years, we have had extreme growth. I've been involved in leadership of the trust for over a decade, and we had 73 employers. Our average size is around 10 to 15. So when we're talking about most employers over 50, they have an EAP. There's a lot of small businesses, small employers, nonprofits that might not have one, might not have the staff to think about how to go out and think about how to have an effective EAP. So we represent about 23,000 people right now, and that's about 1,010 employers. We just hit a new high water mark, which is very exciting for us, over 1,000. So we have 23,000 employees, or I call them belly buttons, covered on the plans that we offer. These are fully insured plans. They have mental health resources built into them. They have low copays. They have a robust network, all of the things, right? We look at our spend every year. Mental health is always the top one, right? All of the conditions related. We know that health outcomes are very much tied to mental health, and that also increases costs. It increases costs for our employers. It impacts people. There are the ripples there. We've always bundled with an EAP. We've always had something that comes along and wraps around and supports our employers. And yet, next slide, please. We had 9 employees, or 9 people last year, 9 that used an EAP out of the 23,000. And this was while spending as many resources as we could possibly think of to do marketing and outreach and all of those things. So, sitting in my leadership chair, I said, why bother? Like, what's the point? We know people are getting it through their health insurance. What's the point here? And so we went to our employers and we said, well, what do you want out of an EAP? And they said, we need it. We need a resource. We need something that is approachable. We need something that we can talk to our employees and refer into. but we need more. We don't have the time, energy, etc. So we, next slide, we went out to bid, looked at a few different EAPs, and we needed to do things differently. Going back to our core value, we wanted to do things differently and support our employers. We wanted a more concierge approach. So I like stories, so I'm going to tell you a story about how we came to what we were even looking at. So we had a team member in our organization who was going through a lot of things in her life, right? And her ability to engage, we were talking about for every dollar spent on EAP, you get $4 back. I can tell you, like, I am the testimonial to that, because when she has support, when she has that is not just a traditional engagement through her insurance and prescription and the counseling aspects, when she has a coach to come alongside her and coach her through how to deal with a child with disabilities, or how to navigate a financial crisis. Most productive person I will ever, like, I'm not even going to tell you her name because you'll steal her. She's incredible. So, and that's what we're going for as employers, is coming around and wrapping around employees there. We want it to be accessible. We know that people want to engage in different ways. And it goes beyond, I think, what can happen just in insurance, right? The bridge, we want that to be a bridge. We want it to be a place people can engage quickly, get help, get connection, and get resources beyond that. So we selected, next slide, we selected an EAP BHS. You saw a video from them earlier today. And I want to tell you why and what we're seeing now. So one, they had a very large network of providers. That's important to us. But more so, it is that concierge one point of contact that has been very helpful for our employers right now. So, again, when someone is in crisis in all areas of their life, that is one more thing on their to-do list of, I have to go check my network. I have to go do this, navigate. What's my copay? How do I do this? Where do I go? Whereas in our EAP solution, this was important, that someone had one person to go to, one thing to do, and then someone to walk alongside of them. We also wanted to have, 2 slides forward, please, to go beyond, to do things differently, do EAP differently. And so we designed our EAP benefits to go also into financial and legal consultations. When someone is going through something that is touching those areas, a tax matter, or helping move to someone to elder care, for example, and all of the things that go along with that, those are incredibly stressful and big things in life, and you need support around that too. And then we're able to then bridge the gap later into the traditional insurance model. Going all the way back, next slide, please, is our resource. That is hands down our core value, to be a resource to our employers. And this is one thing that I really encourage all employers, regardless of size, to do, is to put on the hat of, how can I give resources to my employees? So what we have done, and we have had great results so far, is we've been doing monthly webinars for all of our employers. This is then a library online that employers can use, send out, and continue to utilize. We asked our employers, right, getting feedback from those who are going to be using it, what do you need? And professional development was one of them. All right, so we know they want professional development, they want EAP services and support there. How can we marry the two? So, for example, we did a webinar last month on time management and workplace stress, right? Great. We had an employee attend. Her employer said, hey, I want you to bring your team to this, so you should also attend this webinar. And she reported this back to us afterwards. She said, I went to it and was like, I actually love my job. I don't have stress in my job, but all right, sure, sit here, do the lunch and learn thing, right? And afterwards, she said, oh my goodness, I am drinking 14 cups of coffee a day. Right? That's way too much, by the way. When I drink 3, I wake up with heart palpitations at night. It's too much coffee, 14 cups. of like 12 to 16 ounces, right? She's like, there were people in my life saying, I think you're a little stressed out. I think there's stuff in your life that you need to deal with and get some help. I'm fine. Nope, I just need more energy, right? Well, in this marrying the professional development and that EAP as a resource, because all of those who are watching have this as a resource, the speaker was talking about what are some of the signs of anxiety and depression, excessive caffeine use. And she's like, it hit me like a truck. I was like, oh, I've heard this from trusted resources in my life. I know this resource is available to me. I know all the things I should be doing. I don't have time. I'm fine. I just need another cup of coffee for more energy, right? And that was the pivotal point for her to engage and say, okay, actually, I think I probably need to do something. And now she's down to 3 cups of coffee a day, which is great. So, really bringing that to employees and letting employers, again, we're serving 10 to 15 employee groups. And so coming alongside that employer and saying, here's a resource for you to talk to your employees about things that touch mental health, and then to normalize that, to incorporate that, and then to also have, and here's some resources for you. Here's a one step that you could take, or you can go online and, there's lots of resources, which I really liked, that people can engage with online. Some articles, videos, those sorts of things that BHS was able to provide us. So we made this switch this year. We're only 5 months in, and we've just recently started doing these webinars. These numbers aren't huge, but when we're talking about 9 people last year, we're making progress. And beyond that, what we're seeing is employers using the tools and pushing them out, because there is value, there is productive value, there is utilitarian value for an employer to be able to connect the dots and to take it outside of just what's happening at home, but bring it to the professional development side, bring it to the whole person side, and to start talking about, like, if you are healthy, back to my first story, when that employee is healthy, my stress is down. Our organization is doing better. We're able to serve employers better. We're more creative. We're more productive. And she's happier. She has that fulfillment. She is able to engage in not just her own life, but at work too, and to show up as her best self. And I think that's, in my opinion, what we miss sometimes in this world from an employer standpoint, is just focusing on what's happening at work or just focusing on what's at home. They are completely interchangeable, 100% interchangeable. All of the things that happen at home happen in the workplace, and we need to support in both, kind of that wraparound. So I will turn it over to you, Bill. You want this?
Yep, thanks. Good morning, everybody. Thank you so much for having me here. All right, here we go. Next slide, please. So I lead caregiver benefits and well-being at Providence. I'm based here in Seattle. I've been with Providence 2.5 years. Prior to that, I spent the previous 10 years at the Walt Disney Company, where I led healthcare innovation and benefit strategy. So when you think about Providence, it's almost 200 years old, which kind of is amazing when you think about that. It was started by sisters from Montreal who wanted to tend to folks moving west, and they started their ministries out here. We have 51 hospitals, almost 120,000 caregivers, which means we roughly have just over 200,000 people on our health plan. So between the caregivers and their family members. So we have a rather large footprint. We are very much committed to mental health and well-being. The organization invested $106 million into the Wellbeing Trust, which is run by Dr. Arpan Wagri, who is one of my favorite people and a good friend of mine. Arpan is phenomenal, and you just meet him for 5 minutes and you're best friends for life. So I would encourage you to talk to Arpan, have him come in and talk to your organizations. He truly is amazing. Next slide, please. Why we focus on mental health matters and in how we address well-being. We have our well-being program just got recognized as being one of the best in the country. Marcy Wilson, who runs that, should be the one who's here today, but she couldn't be. So you get me instead. Marcy's amazing. Her team is amazing. 1 in 5 U.S. adults have some form of mental health disorder. And stress is a leading lifestyle risk issue, whether it's obesity, lack of physical activity, all of that leads back to stress. And U.S. suicide rates per 100,000 are increasing year after year, as you see on the chart. Next slide, please. I really love this chart because I think it says so much. The darker the color, the less access to care. The best state in the union is Massachusetts at 160 mental health caregivers, 160 residents to 1 mental health caregiver. All right, as a New York fan, I think that happened. It built over time with the Red Sox disappointments over years, Tom Brady leaving, and this year the Bruins imploding in the playoffs. I think it just has been built up over time. The worst is Alabama at 990. Massachusetts has a slightly smaller population than Alabama, but there are 20,000 more mental health practitioners. I mean, it's just staggering. And if you look here in Washington, we're at 270, which is not bad. It's on the upper end. But if you look at where the darker states are, they're in the southeast. So it's just a matter, I think, of time. As more population moves there, I think the density will improve. But the average wait is 25 days across the nation to get into an appointment. I try to hold our vendors to 5. We're pretty good about that. I checked the other day, it was 3. So, but we are really aggressive on pushing on that. Now, if somebody wants a certain demographic or somebody that has gone through certain issues like they have, loss of a child, something like that, that takes a little bit longer, obviously. Next slide, please. What's driving these behavioral health issues? Technology addiction. I mean, I'm guilty. My iPad's right by the night table. I use that as an alarm clock, right? I was up at 2 o'clock this morning because I couldn't sleep. What was I doing by 2:15? I was on the iPad. Information overload, social media, trauma, and that's very important when we talk about our caregivers for what they went through with the pandemic. I stand in awe of them every day when I hear stories or see what they do. The frontline caregivers that we have are just flat out amazing. And we try and do everything we can to make their life as best as possible. And of course, everybody has increased workloads. That's no different. Next slide. This really struck me. For every suicide, there's 25 unsuccessful attempts. Those folks end up in the ER. Our caregivers are the one taking care of those folks. So you put the stress of the pandemic, you put the stress of the mental health issues. It is a lot for our caregivers to get through. Next slide, please. So they have what's called empathy fatigue. Burnout has been around for a long time. Dr. Maslow we've talked with her. ARPAN is also focused on burnout and helping our caregivers. It was present before, it's more present now because of what they went through over the last couple of years. Stress, anxiety, the higher intensity of care, it's been rough for them. So prior to the pandemic, we were considering that we had access issues with mental health. If you look at Deadliest Catch, when one of those guys gets hurt, he ends up in one of our hospitals on Kodiak Island. There's not a lot of practitioners on Kodiak Island, right? So we went with a telehealth provider for mental health that has done incredibly well for us. We're 12% year-over-year growth every year. And it's not more visits per caregiver. Those have stayed pretty static. It's more caregivers getting engaging, which is what we really want. So our approach to supporting mental health well-being for our caregivers and our families was 4 points. Improve access, modernize the program by leveraging advanced technologies, promote programs that support whole person care, and create a seamless caregiver experience. I'm going to go through each one of them. Access, provider networks, availability of care. We had these issues. We have multiple hospitals in Alaska. We have Montana. We're in Lubbock, Texas. We're in New Mexico, right? So it's how do we get care for these folks? Now remember, our folks are 24/7. So how do we get care for a nurse that works the late shift? Or how do we get care for a nurse that has an odd schedule and works certain days and really wants access on a holiday? So that's why we went with the nationwide telehealth provider to provide that. We have 14 on-site full-time EAP providers at our hospitals. Some of them spread between different hospitals if they're close enough. Out of our 51 hospitals, 14 of them have a full-time on-site EAP professional that just focuses on our teams there. By going to one network, we've aligned the provider reimbursements and the national advocacy investment that we talked about with ARPAN. We're modernizing our program by leveraging advanced technologies, so we've streamlined it. What we had a website, or I'll say we had multiple websites across the organization where everybody had put links up of access to tools. We put them all together and it was like 50 links. It was way too much, it was way too confusing. We've recently pulled them all into one website. Everything is there, and so it's much easier to get to the tools you need. And there's tools for yourself, there's tools to help others, and there's tools for family members. We have to meet our caregivers where they are. If they need help, we have to find a way to help them. And not everybody accesses care or knows how to access care in the same manner. So for instance, a lot of our caregivers only have a phone. So when we went out, we had to make sure it was, mobile enabled. Everything we do is built around the phone, because that's pretty much, if you have a PC at work, you're good, but some of our folks don't. So the phone is pretty much their main point of access. So we have to make sure that whatever we do can be done on a phone. So that you can schedule online, intake support triage, which is hugely important. So when you go in and you ask for care, you take a quick survey, and if you flag on that survey as somebody who needs help right away, you will get a call hopefully within 2 hours. We're trying our best to make sure that happens. Sometimes it's a little difficult, but you will get a call as soon as humanly possible, where you will talk to a human being, and that human being will help you find care. And we can if you're close to one of our facilities, we'll get you in as quick as possible. If right now we are in 40 different states, and so it is a little tough for us to handle like the 20 people that sit in New York for us. So we're trying to work through how we solve that. But if you can get into care, if we can get you into care, we get you in right away. And mobile. Next slide, please. Internally, we support whole person care, which is our Wellbeing group, which, like I said earlier, I'm blessed. They do an amazing job. Anti-stigma campaigns. Core leader resilience is something else that is truly amazing that is done here. We have a program called No One Cares Alone. And what that program does is it calls every core leader in that organization. A core leader is somebody who manages somebody else and says, how are you doing? Do you need help? Is there anybody you're concerned about? And it's done by a third party. So there's privacy there. And then we get them resources. And we've probably pulled roughly 20% of those calls end up with somebody getting a resource. So we're trying every direction to make sure that our caregivers are taken care of. Counseling utilization, spiritual health, something else that folks said that they wanted. We've just put that in place. It's in its infancy now. It's just started. But if somebody wants some sort of spiritual health, that's fine. It's there for you. Next slide, please. Things we're working on, aligning behavioral health and EAP provider network. We're trying to align with the medical as best as we can. That is not as easy as possible, even with us. We're integrating well-being and behavioral health benefits. The EAP leadership sits on our well-being team. My well-being leader, she manages it all. And as always, engaging mobile experience. So those are the things that we're trying to do. Where we go from here, we're seeing the increased utilization. We're 12% year-over-year growth. We're trying to improve that network coverage and access like we talked about. If you are not patient-facing, for the most part, you don't have to be in the office. Leadership has to be in a little bit more. I'm in roughly 1 day a week. It's really not a problem at all. And some of my team, they don't even live near. I have somebody in Knoxville, Tennessee now, right? So it's a matter of we're trying to be supportive of that. We look at it as an advantage. But if for as the benefit administrator, we have to make sure we can treat everybody the same and they have equal access to care, which is a little difficult when you find out people living in some pretty strange places. But we also have a caregiver experience survey, which we really focus on. 2 of the questions on there: does Providence care about my well-being? Is my stress level at work manageable? We track those. We do a yearly one and we do a mid-year check-in. Those questions are on there, and reduce suicide rates. So those are some of the things that we're trying to do. Thanks so much, guys, for your time. Really appreciate it. I'll just keep it.
Thank you, Bill.
Oh, here. Okay.
How's that? Better? Great.
Thanks, Bill.
Thank you both. So I think what I noticed we all had in common was our passion. And obviously everybody in this room feels the same way. Your passion about helping people and about caring for others and continuing to be innovative in how we do that and wanting to do the best. Your stress goes down when you know you're doing the right thing. You know, that's true for all of us. So it's rare that I get to sit in rooms with so many caring professionals. I mean, I was just at a conference, that's one thing, but it is important for all of us to be able to connect and know why we're really here and what's driving the work that we do. So this panel is going to focus on a couple of questions similarly to what you saw this morning. And because the two of you are so passionate about what you do, and obviously, Bill, you're not sleeping at night, you've revealed that is actually true.
Don't do 14 cups of coffee. No,
You know, I don't
do
drink
it.
coffee, which is even sadder.
Neither do I, actually.
Tea.
So because you're up at night, you know, that expression, what keeps you up at night, and in the HR world, we've talked about that a lot, but so what continues to keep you up at night as it relates to the mental health and well-being of your members? For you, Bill, it may be your caregivers, and for you, Sarai, it may be Sarai. It may be the people that you serve, but what keeps you up at night?
I think it's mostly, what am I missing? What can we do better? How do I enable my team to be as amazing as they are? It's just, you know, it's more, it was the old Intel leader who said that it's okay to be paranoid. I think I sometimes go a little too much in that way. I'm always worried about how we can do better. Are we being as efficient and effective as we can be? Should we be investing more in this? So it's more, and also I have, not only, I also have some of the other benefit functions, so it's more how do I integrate the two? Like financial well-being is something that is really causing some folks trouble. And it doesn't matter whether you're lower wage or higher wage. Higher wage people can get in financial well-being issues too. And so it's, how do I integrate that? So right now on our well-being platform, it links out to some financial counseling that we have. So those are just like the simple things that we can do that we just need to do better at.
Thank you.
Usually my kids keep me up at night, but aside from that, you know, when I'm thinking about mental health, it really is going back to the employer and how I can equip them more. They become an advocate, they become part of that first line. They are engaging with their employees, they can see issues, maybe performance issues. So equipping them to know some of the signs and symptoms and things that they're seeing in everyday life, and helping them ask the questions, the right questions, instead of so-and-so is always late for work, right? We have a performance issue. Yes, that is a performance issue for sure. People need to show up on time for work. But then going that next step and saying, okay, why? And what do we do? And how do you now help be part of that solution while empowering them to find solutions for themselves? So I think the communication piece is the biggest thing that keeps me up at night. Really getting the right resources and getting the attention of employers that then can engage with their employees.
And I've seen this shift over the years, and I think it's for the better, that instead of taking a punitive approach, which was not uncommon and may still not be uncommon in some industries, it's a proactive, preventative, empathetic approach to providing leaders, managers, and employees resources and maybe giving them the benefit of the doubt. So a poor performer may have multiple issues that they are not speaking about in the workplace. But again, being able to give them the benefit of the doubt and provide resources can help alleviate some of that. Everybody is stressed in some way, and I think, Bill, you touched on that as well. People are carrying burdens that we know nothing about, including our panelists who are waking up in the middle of the night. All right, moving on to question number 2. Considering the statistics we heard earlier about our youth in particular, what concerns do you have regarding this, our future workforce? And how do you see them influencing healthcare benefits in the future?
Go ahead.
I'm happy to start with that. So again, going to a story, I have 2 small children, 8 and 6. At this point, I think if they can just figure out how to be respectful and show up, they can probably do anything. It is very challenging to hire in this market, I will say. You know, I talk to employers all the time around this. The younger generation, it doesn't, they engage differently. In the workforce, there is much more of what I would call a as you wish to engage, you know, where, how, what, right? It's a generation that is used to a smartphone in high school. So I actually define millennials as there are really 2 sets of millennials. One is, did they have a smartphone in high school? And if they didn't, typically you're seeing, you know, more older type qualities in them. That really, to me, is that pivotal piece. And that is what we have to solve for. I think, you know, Bill was talking earlier about making sure there is that mobile connectivity in the EAP. And I think that goes for all sorts of healthcare and all sorts of things. That gamification of engagement, I think, is where things need to go, where things are going. That you choose how to engage, who to engage, when to engage, what it looks like, how easy it is. At 2 in the morning or at 4 p.m., right? There's a whole different set of cultural norms that we have developed through the pandemic and generationally that is a lot different than how we engage, even how I engage. I am on the upper side of the millennial. I did not have a smartphone until I was 26. So, but, you know, that's really a very defining piece there is, you know, the technology that is always in our hand. And I also am addicted to technology, right? My daughter, if I leave my phone somewhere, here, Mom, here's your phone, right? And that is really how people are going to continue to engage. And I think as employers, we need to adapt to that, both in the work environment, but also when we're talking about mental health and healthcare overall.
I think I agree with what you said, but I think it's also, we have to find a way to bring them in and attract them. As we talked about earlier, 20% of the healthcare workers just left, whether they retired, whether they just decided this wasn't for them. The pandemic really did a number on the industry. And we have to find ways of what works for them. I spent a lot of time talking to our diversity groups, trying to figure out how we can improve there, but it's also, you know, what kind of benefits do they want that maybe, you know, I'm Gen X, that I would have never thought of, like pet insurance they love, right? So we provide pet insurance. But it's simple things like that. They look at the employer sometimes as they should do all these things for them that my generation would have said, why would I want my company to do that for me? But they look at the company as, you're supposed to provide all this for me and ease my way and just do all these things for me. And whether or not we agree with the expectation, they are the future workforce. So we have to find a way to attract and retain them. And so we have to take a look at what we're offering and does it resonate?
Yeah, both good points. I'll make a point. I'll take it out to the audience. I think it's interesting because as technology matters, and I think we have to meet people where they are. But is there still room for in-person and relationship building and that sort of thing, and not just focusing solely on technology? Yeah, we have a question from the audience. Go ahead.
I just wanted to echo what you said and maybe add a question to that. In easing the resources for your employees and your professionals, have you considered that employers should maybe engage with community-based organizations, in particular the CHWs, to help with the employees and staff in regards to triggers, resources, and the crisis intervention part in regards to mental health or any other chronic disease management? Because the community health workers who are in the CBO areas where your hospitals and your employees are based are the ones who they leave their children with, or that's where their lives are. Have you considered working with those CBO organizations to ease your burden of employees' fatigue, stress, depression, and all these other things in conjunction with resources and working on triggers in regards to them understanding the environment and what's on the ground and how fast they can receive that and follow-ups, because there's one thing to give them resources, but for sure there's different levels of follow-up and continuum of care. So how far are you following up on continuum of care? I would want to know how deep is a continuum of care in terms of when you do the every 6 months review on mental health for your staff or yearly, how deep, and I mean how really deeply do you follow up in terms of, are you really okay? Do you have all the resources you need? And what resources did you receive? Did they serve you? Did you understand where you're lacking on ABC? So something of the sort.
Thank you.
Yeah, I can. We do a mental health parity analysis every year. It's something we recently put in place. It goes into based on community access. It does testing. It's done by a third party. We also, Providence in 2016 created the Wellbeing Trust, which focuses on mental health improvement in communities. So I think there's been a really outward push by us. When you think about our mission is know me, care for me, ease my way, okay? And that's how we work with our employees. We try to understand who they are, how we can care for them, and how we can make their lives better. So yes, can we always do better? Absolutely. Are we trying to get there? Absolutely.
So there's two things that we do. One, we are just in Washington State. So, our footprint is, not on a national level, which I think gives us some advantages of being able to work with CBOs. So we're connected with a number of Chamber of Commerce's across the state, as well as their CBO partners and other resources within each community that we have a population in. And what we've been doing is rolling out our kind of webinars and those resources to those organizations as well as making them available in other languages. So first, connecting people into a community resource. Second, highlighting a community resource that might be there for them. And then also, extending that education and support beyond just the population that is, paying for their insurance with us, but really trying to move the needle in that community and be that connective tissue a bit. So that's one of the things we're doing kind of on the CBO piece and like the community engagement. In terms of the follow-up, one of the things that I am really passionate about is that follow-up and that continuity of care. I know from personal experience that when you are dealing with, for example, postpartum, I had postpartum with my first child. I could not even think past anything. Like that was one more thing on my to-do list that I was not going to take a step, right? But having someone follow up and be like, hey, you haven't made an appointment yet. Can I help you make that appointment, Nancy? I have these 6 providers and they can see you virtually or in person. You just took the whole weight of the world of what people are sifting through to 2 decisions, right? It's like Tuesday works, virtual works. Okay, thanks, right? And so that's kind of how we've tried to model our EAP with BHS, is that more concierge model where there's one point of contact, and part of our contractual expectation is follow-up and assisting making appointments, as well as making multiple language supports available as well. So when we're looking at a to-do list, this can't be another thing that we add to people's list. This has to be something that they feel like someone's walking alongside them.
Thank you for the question. Okay, so another question I have for you both. What's one recommendation you have for employers who are seeking to improve their mental health and behavioral health benefits?
Don't let access be an issue. Virtual. We enhanced our benefit from pre-pandemic 10 visits to 25, no cost, no questions asked, just get what you need. And we really don't, I mean, if somebody needs more, they get more. I mean, it's access, just get them the access and promote the ability that please get the help you need.
I would tell employers to take advantage of entry points, right? To normalize the conversations in the workplace through, my example of the professional development webinar and training that we did. It's a more accessible first step that someone can take. Again, I'm dealing with employers that are small and might not even have an HR department. Someone who's, a business owner or operator that is wearing multiple hats. So to have bite-sized pieces of how to engage, I think that's the first step for, my charge as a leader. And then I would encourage employers to take those steps and to, take that 15 minutes to send out, encourage your employees to attend, and encourage your employees to engage.
Thank you both. Anybody else in the audience want to add to that? What you would do? Yes.
So maybe I'm old generation, but we talk about digital, we talk about, blah, 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 blah. And I mean, I think as we were discussing earlier, loneliness is extremely high and plays an extremely important role in the fact that a lot of people are struggling with mental illness. So what I really would encourage everyone is to think, how can we bring our employee back in person? Not like saying you need to come once a week or anything like that, right? But can we maybe once a month have a breakfast with everyone, or really kind of organize something so that people can, they can come back, they can feel connected. So I think that's very important because we talk about, everything kind of, which is fantastic. We offer that as well, to have all those virtual options, but don't forget that, again, loneliness is a driver of depression.
Thank you. Connection, right? Relationships, connection. I've got one final question before we're out of time. So what's one request? I love this question, by the way. Talking about the system, what one request do you have of this system?
Integration of care.
Mm-hmm.
So that we don't miss gaps.
Yeah.
I would echo the integration of care, and I would add ease of access. So having providers and having the system have multiple ways to engage. I think, you were speaking earlier about the group therapy and groups, support groups. We are built for community. Thank you for highlighting that. We are built for community, and I think the pandemic really showed that. So having the multiple ways to engage, I think, is incredibly important. And again, taking care of that whole person. Sometimes I feel the system focuses on the specialty, that provider, that specialty, right? It is a specialty, but there's a whole lot more that needs to be integrated.
Yeah, I think when we got away from holistic care, and that was a long time ago probably, but we separated out how we pay for care by whatever is called health and whatever is called mental health. And is that separated here? Or where is it in us where it's separated? It's not, it's all integrated. So if we can get beyond how we pay for care and really think about how we access care and what we can give to people and create that sense of community, I think we'll go back to where we were supposed to be and where we need to go. So thank you. Please join me in thanking our panelists here and for your participation.
Thank you. Thank you to Nancy Board, Sarai Childs, and Bill Dinger. Really appreciate you being here with us today and sharing. And I was prepared to make closing comments, but I'm not quite sure how I piggyback on how Nancy just closed off this panel. I mean, truly going back to our payment system and how are we paying for the care, and using that to bring everything back together to the holistic approach. Sandrine started us off this morning, Dr. Pirard, with the definition of wellness, right, and the 9 components that make that up. So we've just come full circle in this program, and I greatly appreciate everyone who's participated here and hope that the next time we host a program that we see more people in person, because we have learned about loneliness and the need to connect, and we're doing our best here to help all of you build those connections. So thank you.